Hello and welcome to Network Insights from Move Consulting. For those new to the series, Network Insights is our opportunity to speak to some of the amazing people who make up our network and for them to share insights into their work in supporting people to be more physically active. Today's conversation is titled Supporting People to Live Longer Better, and we're going to focus in on the topics around physical activity in later life and the importance of how collaboration and sharing learning is part of the solution. So, without further ado, I'll hand over to Elaine to get us started.
Good morning, good afternoon, whatever time of day it is with you. We're really lucky to have with us today Annie Holden, who works for the Active Partnerships and has a lead for the Live Longer Better project. But I'm going to let Annie sort of introduce herself and share a little bit of her background, because you've been involved in physical activity area and health in particular for quite a long time, haven't you? Same as myself, before I say any more.
Yes, quite a few years, Elaine, yes. But first of all, just thank you, both of you, for inviting me to be part of this series of insights. It's great to be invited and to talk a little bit more about Live Longer Better. But yes, Elaine, I've been around quite a long time in this space. So my background has always been underpinned by this absolute passion for physical activity. But I started off as a PE teacher many years ago, and then went into lecturing around, sport, health and fitness and exercise. And I'm fortunate, I've had quite diverse opportunities, but all in that space. And then I've done a lot of work through the majority of my career, really more around cardiovascular health, prevention and treatment and management from a physical activity perspective. And I still course direct and tutor for the British Association of Cardiovascular Prevention and Rehabilitation. So with that, then, I've always had a real interest in the workforce and supporting our sector as well, in terms of their inclusion within the health space. So, yeah, I've really always been thumping that tub. And to me, I suppose, our area of work, my area of work, there's nothing difficult about it. There's nothing rocket science about it. It just makes sense. And there's that wealth of evidence base, substantial evidence base, as we know, around physical activity to improve health, manage health and treat health as well. So it just makes sense. So I think that's where I've always adopted that very simplistic approach to it. And then I've now got this opportunity within the Active Partnerships national team to work with Samir Gray, who's the absolute inspiration behind it all, on the Live Longer Better work. So yeah, I'm really enjoying that area of work as well.
Brilliant. You're right about it just makes sense to us, but it seems an awful lot of work to try and make it make sense to other people sometimes. But we're getting there, definitely. Yeah. Can you tell us a little bit more about the Active Partnerships and what their role is?
Yes, so Active Partnerships, there's 43 of us around the country, around England, and roughly in line with the counties. But we kind of have that unique position of being more the strategic enablers now, the honest broker approach to ultimately supporting the local communities to be more active, but particularly with a focus on improving an activity levels for those who are in poorer health and particularly those in areas of deprivation. But a unique feature of Active Partnerships is our independence, so we can work as this systems enabler, but particularly by working collaboratively with our local system partners, which, as we know, it's not just about another intervention or another pilot programme. It's more around how we can truly address that change at a systems level, and we obviously have that opportunity now with the integrated care systems coming into place as well. So yeah, very much around a collaborative approach. There's no competition. It's all around that collaborative, cooperative, co-production approach, without just overplaying the lip service to the co's. It really is important and does embrace our approach across different active partnerships. So most of us are the strategic enablers. There are some still that have a direct delivery responsibility, but more around that strategic enablement and working with those key system partners to influence the ability to make sure that we can embed physical activity ultimately.
Brilliant, thank you.
In terms of active partnerships and their work, there's obviously a focus from a number of them around key strategic areas at a local level, but also contributing to that larger national picture. And physical activity certainly sits at the heart of a number of their strategies, if not every active partnership. And for some, older people is a priority area as well. So what's the connection between the two? Why physical activity and older people? What's the importance there?
I suppose there's some kind of obvious first responses to that, Craig, in terms of we have an ageing population. You know, we know now that, you know, I think back in 2020 was the first year in history that there were more over 65s than under 5. So, you know, we have got an ageing population. We also know then that there's a negative approach to ageism, whereas someone like Muir, and as we all understand as well, if we can enable people to be active, to retain elements of fitness from a functional capacity perspective as well, that obviously helps offset or manage any underlying health conditions, but also ultimately this is about enabling that independence from an empowering, enabling them to care for themselves. That whole self-care element of our health agenda is something that's such an untapped element. And if we can help our older adults, our older population, age healthily with that quality of life, rather than having that, you know, those more years of disability that we know they'll have to face with. So yeah, a big priority for the active partnerships to try to support that, because that, you know, that older population and that proportion of an aging population within our local communities absolutely needs attention, and none the least of all of the impact in relation to COVID, the pandemic, the ongoing, well, the deconditioning that we saw through that period, of where fitness levels typically, as we understand them, weren't perhaps at the desirable level anyway, and then with the ongoing deconditioning that comes with that, and long-term health conditions we know are just going to, you know, just exponentially increase unless we try to do something about it. And as the first line of this upstream prevention approach that we all fundamentally believe in, if we can absolutely start to adopt that, not just at an older population, but obviously further down the life course as well, then that hopefully will help people to age with a quality of life and have that independence, and then ultimately take the pressures off of our health and social care colleagues, which we know that they are absolutely facing at the moment.
Yeah, and as we know, at the time of release for this episode, which will be just after Mental Health Awareness Week has run, the focus of that's been around loneliness, and that older age bracket, or as we age, as we term it, instances of feeling lonely and more isolated start to increase. And at the same period in our lives, we start to become less physically active, whether it be social opportunity there. We think that that's what older people, in inverted commas, should do, or it's connected to our health in some way. So COVID's had a real impact in relation to that. So the work that the active partnerships are doing, and Live Longer Better, which we'd love to learn more about, is ever more important. So it's more than those big things that can feel kind of just out of our control and influence. The fact that we have an aging population, well, what can I do with my little program? I think the answer is work collectively and work together. So that for me brings me to Live Longer Better. It's the title for our conversation today, and it's the title of the program of work that you're managing at Active Partnerships. What's it aim to do? Tell us a bit more.
To go into Live Longer Better, and to pick up in terms of you've just quite rightly focused on, Craig, you know, in terms of the wider benefits of being physically active or being fit, you know, from our perspective, is Muir will always keep reminding us that he actually gives a slap wrist every time we use the word physical activity, because he says we're underselling ourselves. You know, it's activity, physical, cognitive and emotional. So in that's exactly what you've just addressed there in relation to, we know that being connected to a social group through an activity of some sort will really help improve an individual's self-esteem, their mental health, etc. And we know that through the pandemic as well, and Age UK's national third wave research that came out in February this year identified again, you know, roughly a quarter of people, their anxiety had been impacted upon. They felt more isolated as well. So yeah, absolutely, that's what this Live Longer Better movement speaks to, the wider opportunities around physical activity, and using activity, cognitive, emotional, and physical as well. So making sure I get that, yeah, because otherwise I'll get told off. Here will tell me off on that piece, so it'll slap my wrist. So fundamentally, I suppose the aim of Live Longer Better was always to steer towards a new culture, develop a new culture from care to enablement, where it was always seen from an ageing population, people need caring for or doing for. And that's where Muir has fundamentally come in and said, look, you know, with the power of being active and then the additional benefits that comes from that, if we can enable people to continually to remain independent in their own home and to self-care rather than having other people care for them, then that ultimately will help change and turn the tide in terms of healthy life expectancy as well. So yeah, it's that cultural revolution, and we can only achieve that by working across systems and across partnerships, as we said earlier, and then ultimately to increase the health span for older adults, improve their quality of life, and then with that is to address and to look at the systems and networks that will impact on that level of change, that level of cultural revolution, as Muir always likes to look at it. But you know, fundamentally, we can significantly have an impact on individuals' healthy life expectancy. And just to quote some numbers from that I've noted here, and it's one that Muir always he does cite, and it's from the King's Fund's estimates that, you know, if we can increase healthy life expectancy, then we know that we can reduce the pressure on health and social care by 45 million per million population. Then, you know, there's huge benefits in relation to that, and physical activity absolutely plays a phenomenal part in that. So it's that enablement that we're looking at, and that empowerment, as we would know from a wider perspective.
Yeah. It's interesting you talk about the different sort of, I suppose, the age graphic of it all, because we used to talk when I was working at the BHF Centre with Bob LaVenture. He did quite a lot of work in the care setting and care about physical activity, which was put into every single care home in Scotland, and ran for a number of years. And having been in the situation recently where I've been visiting relatives in care homes and recognising the challenges they're currently having in managing just doing their daily tasks, it's those things that seem to have dropped, and there are a lot of people sitting in chairs for very long periods of time watching telly and not a lot else happening, because they are so short-staffed because of COVID, staff people being on and off. And it is really worrying. It's because I mean, there was always concerns about going into care homes and people becoming very deconditioned very quickly, but in a sense that's happened when people have been enforced to shield, and been stuck in their homes, and all of that has continued. So it's definitely a real challenge for the care sector going forward.
Yeah, at that point that you make as well, Elaine, we've been having conversations in the previous week about how what we knew 2 years ago and what we know now, the reality is we don't really know the true impact of COVID and what it's mean. We've got an idea that things like the big themes are coming through of everybody's essentially gone and sat down for 2 years or not gone outside and been as active as they were. So the deconditioned, as it has been termed, and that's going to have a disproportionate effect on different demographics. Particularly, we know when we spin it on its head, the most benefits come from being physically active within that, from CMO guidance terms, 0 to 29 minutes. That's when that bell curve, or dose response curve, is the strongest, steepest lift, isn't it? So it's really interesting that we're focusing in on certain areas now, but that learning curve for us, as we start to realise the true impact, is going to be another 2-3 years in the future as well. But from what we know, there are definite markets of or demographics, sectors of our communities that were impacted and at most need, and they still retain the same. Essentially, the gap to a degree is widened slightly. When we look at Activity Alliance data in relation to the gap around those living with a long-term condition or disability, they've always been one of the most kind of impacted negatively as well. So the priority area for older people, as all of the kind of challenges begin to stack up for us, really, really important. Now, this is a bit that popped in my mind when you were speaking before, Annie. For Live Longer Better, how does it operate? You mentioned that you are obviously with active partnerships, of which there are 43, but is it the Active Partnerships Club? Are there other organisations involved in that community, if you will, that are sharing learning? Who else gets involved there?
So just to give you a little bit of background to kind of the structure and the content of our approach to this, and I could come back to your points and we could just discuss this forever, couldn't we, around the impact of COVID, but actually the issue was already there before, and has it just been exacerbated, and this has been brought to awareness around actually, and I do think, I just need to say that at this point in terms of that, we do have to see it. Sometimes I said that through the COVID, that actually out of adversity comes opportunity. And I do think it has raised the profile around physical activity, around physical activity in terms of, improving health. There has always been this issue around long-term health conditions as well. And it's not been addressed in how physical activity can support the management and the prevention of it from an upstream perspective. And I do think we have got an opportunity now to really forge ahead and to work together with those ears that are listening. And there are lots of people at a national level now, senior level, who are listening to people like us, and coming back to Live Longer Better, people like Muir, who has got those ears already, and he's knocking on doors and saying, let's be very aware that physical activity is really important. Our activity is really, really important for these individuals. And yes, whilst we've seen Active Lives data, from the recent data published for November 20 to November 21, levels are getting back. There's still a huge amount of inactivity levels out there, and it's disproportionately affected, as you quite rightly say, with those with long-term health conditions, disabilities, and in the disadvantaged areas. So the problem's there, it's been exacerbated. And then with Live Longer Better, then our approach to try to address some of this, coming back to your question there, is we initially, when we started off in November 2019 at the height of the very early stages of the pandemic, we went out to active partnerships across the network and said, does anybody want to come into this community of practice and learning, in a recognition that yes, there was an acute agenda out there that needed addressing from an inactivity perspective, as well as then addressing obviously the impact of COVID on that older population. And was there an audience? Is there an audience? Is there a willingness for people to join this, particularly with knowing that we got Samir Gray there, the inspiration and obviously the credibility that he has. And there were 17 that initially joined this community of practice and learning, if you like. And in terms of joining, it was a recognition of, well, that for your contribution, your commitment to this, then what can we do to support the active partnerships? Now, from 2019, that went from 17, it then went into 22, where we had from losing track of the years now, from September 21 to the current space, it was 22. And we just moved into what we call now our phase 3, the next 2 years of this programme, and there are now 29 active partnerships. So of the 43, you can see there's a huge majority. Now, that's not to say that those who haven't committed themselves to be part of this network, that they're not interested in it. That maybe that they've already got a lot on their plate, that they're all very, very well advanced. But the community of practice and learning has been structured to really facilitate that sharing and learning platform amongst active partnerships. And that's something we've really tried to draw out over since inception. So the structure of it is that we have bi-weekly workshops for those active partnerships. And it focuses now on once a month. One of those bi-weekly sessions is a professional development and learning sessions, tackles some of those really more wicked issues, challenging issues around systems change, ICS, stakeholders, partnerships, digital, all of those kind of elements. And then the other once a month bi-weekly session, if that makes sense, focus on a little bit more of a themed approach. So it could be the active aging campaigning, where local active partnerships want to really focus on that. So we very much flex and develop the programme according to the need, and very much is sharing and learning, very open. But we kind of have this protected space of a Wednesday morning 10 to 11:30, where the active partnerships know that if we're going to have any of our sessions, then that's when it will be. We also hold the National Thought Leadership events, which I think you'll both be very much aware of, and they have been hugely successful, and they are very open to that multi-sector representation. So we're on to our 7th one coming up on the 8th of June. A little bit of a plug for that one, but we've had over 2,000 delegates attend so far, and every event we have 200 to 300 delegates that sign up to that event. And just popping back quickly to the community of practice and learning, it isn't an exclusive club, I think, as you queried earlier, Craig. Yes, it was open to active partnerships, but what we're doing now is we're seeing that, as you'd expect, those local active partnerships, if they're truly working across their system partners, they want to engage and incorporate some of those partners into our session. So literally today, again, if someone said to me from an active partnership, can our local public health colleague join into these conversations? Can this person within Age UK? Absolutely. So we are extending the network. So it's not just an exclusive club there as well. And then the other element, just to conclude on this structure, is that we do have a national network group, so that we try to address the divide and bridge the gap between that local and national. And the national network group is representative at the moment of Sport England, of Centre for Ageing Better. We've been very instrumental in this as well, as has Sport England, and both of them have financially contributed in some way as well. OHID, particularly the older people team, Age UK nationally. So we've got that representation, and we're growing that representation. And it's not just a talking shop. We've got a meeting tomorrow. It will be very much sharing objectives as well, to try to see how we can support the achievement of each other's objectives and priorities, so that we can really make those connections from a local to national. So it's not the hierarchical top-down approach. We're trying to address that imbalance there as well. So I hope that's given you a bit of a feel of the structure there.
Yeah. No, it's a lot of work going on. And it's great to see. I think one of the things that I've always been concerned about is there's these wonderful pockets of great practice across the country. But that's what they've remained, because there's just never been that sharing of practice. The old BHF conference used to try and do that to a certain degree, but that's been lost to quite a large degree. So it's good to see that still happening, and it's good to see that coming back. So yeah.
It's a tough nut to crack, that concept, because what sits behind the idea of, I love the national to local focus. And in relation to the work that we've done previously, it's an ongoing frustration, if you will, of the theory not connecting to the practice, or what we learn not actually being applied. And you end up with these two camps, and the usual phrase of, well, they sit in their ivory towers and tell us what to do, and it doesn't seem to make sense. But the whole concept of collaborative working is that the policy should be driven by the practice, or at least the experience, or at the most the experience, I'll say, to correct myself, so that policy is reflective of what's happening on the ground, and things do start to move forwards. The tough nut to crack in that is that question of scalability that comes about, because it's a constant one. How do you do this that's working well over here and just make it bigger? And we know this, we've seen this happen loads and loads of times, but Manchester as a urban setting, I'm in the north, so that's my local big city, if you will. That's not rural Cheshire, even though it's only 15 miles away. So although there is sharing of learning, which is the most important part that I love about what you've shared, Annie, it's not necessarily with the drive of just replicating what's happening, because that's copying, that's not learning, is it, in that sense? So thinking about how the application goes. So this leads me, in terms of that learning part, what are some of the themes or even specific practical elements, Annie, that the group, if we can call it that, the Live Longer Better programme, are unearthing in relation to that systems approach, and what is working better to support people to live longer better?
I think you've touched on some very key points there in terms of what is working better and what's coming out of that. There is, and it's taken time, and none of us have got, it takes time to develop this type of approach, but it's definitely around the concept of around this community of practice and learning. We are a community, and our active partnerships are reflective of the community that they also serve in, if you like. But it is that issue around, you have that national policy, that national report, the national latest insight and audit, but the so what question, so what does that mean? And that's where we've really been able to galvanise some of that, I think, to a small degree. We're still in early stages, but that's where with the active partnerships coming in and sharing what they have done, how that report, that piece of policy has been pragmatically applied within their local community. Their sharing of that across the community practice and learning as a starter has helped the active partnership guys themselves realise that actually, what I'm doing is contributing to the local community, or that's given them the confidence as well as increasing their knowledge around how to open those doors at those critical senior manager levels, and to have those meaningful conversations, having the confidence to understand, that worked over there, I've understand how that's been applied, this is how it can be pragmatically applied here. It's got to be the place-based approach at the end of the day, hasn't it? Because we know otherwise it's not going to be meaningful in any setting. And simultaneously, that realisation has certainly come to fruition more with the national network groups that we work with. So, I met with Age UK National this morning, and they have got an absolute desire, as we have, to make those connections, to work more collaboratively together. So that first of all, we can do that. Let's work out exactly who is working closely, active partnership and their local Age UK. How can we make those connections, facilitate those connections a lot more? So that then, of all the reports in the world that come out, we actually are thinking about, so what can we do with that? And there's a bit of test and land opportunities that are coming out now as well. So I think that's what's really, I find quite satisfying about this area of work now. There's no rules for it, but we know that we all collectively and collaboratively need to work a whole heap better together, and let's learn from each other and a local perspective as well as from a national perspective.
Yeah, that higher level premise as well, or principle approach, you could apply that to anything in relation to the topic area. Obviously, we've said that our topic of conversation for today is going to be around older people. Are there any examples or stories you can tell of maybe a partner as part of the network that have taken that whatever piece of learning or practice that's worked elsewhere and applied it?
I think there's a key piece of work that's going on with an external evaluation partner that's been appointed, and this was through funding that came through from Centre for Ageing Better, and we have Andy Brogan and Ruth Ball Ruth Hall's with us, and they're from Centre for Public Impact. But they are doing that piece of work where they're supporting the active partnerships within the community of practice and learning to have an understanding of how they are working towards changing the systems and developing relationships. And it's a lot of, they are doing it, but they weren't aware of it. But that approach, that relationship mapping, for example, is transferable across the entire life course. So when we're talking about systems change approach to physical activity, obviously the key principles can be applied across. So that's one example of it as well.
One of the biggest system changes that's technically happening is the new ICSs coming on board over time, and I suppose there's another opportunity there, particularly when we see, there's always been, it feels like there's been a bit of a fight between health and social care because of the way that it's been set up and the different organisations that they've sat in, and this is the opportunity to hopefully bring that together. And when it comes to older people, that's quite a critical part of this jigsaw. So, it's early days, but from your perspective, what's your hopes for these ICSs? What do you hope they're going to achieve?
Well, we've just had the Health and Social Care Act ratified, haven't we? Just had the royal assent. So, we're en route to help these happen. I suppose I could, from my perspective, Elaine, personally, you could be cynical and think, well, God, we're going to go through another systems change approach again, another restructure, and certainly that's what Muir would always say. But, I think the way we're working within Live Longer Better, we know, as we collectively around this meeting today as well know, that this isn't about another intervention or another pilot unless we get it right at a system, that underpinning infrastructure, if you like, to truly embedding and enabling our local communities and individuals, whatever age, to be physically active. We're not going to be able to do that without that partnership approach, that systems change approach. So yes, definitely hopeful, and certainly from Muir's perspective, if we go back to Muir and exploiting him in the best sense of the word, he's in that position. He's such a well-respected person. He's got that credibility. He's got, obviously huge experience as a physician in that field. He can knock on those senior doors at a health, social care and wider level, and he's been doing that for us at a national level and local level. And this is where his value has been huge for the local active partnerships as well. They want to win over hearts and minds of those key people within those systems locally, and they've invited him in to either speak at a conference, a local conference, or just to attend that particular critical meeting of senior heads that they've not been able to influence. And Muir's gone in, and he, that's where you realise that the utilising the experience and the expertise and the inspiration of someone like Muir has been really, really, really helpful. And so he's been really good for us and helpful in that. But then simultaneously, I have to say, I've noticed a bit of a tidal wave in terms of, from a national perspective, as you two would both know as well, from a national perspective in relation to key organisations and how, people like the physical activity team within OHID, they're trying to work together with NHS Horizons and address how to activate the NHS system. And then as part of that, recognising that active partnerships at that place-based level, working with system partners, can have such an impact and a benefit there for everybody.
I think there's a massive opportunity as well around this collaborative commissioning, because I don't know about you, but we've been going round and round over the years with begging bowls often, and you're knocking at one door, then you're knocking at another, and you're knocking at another. And if there's a way of bringing all of that together to collectively acknowledge the benefits that physical activity can have, and create a pathway or through that to ensure that there is a collaborative approach to it, then hopefully it's something that will be of interest to these organisations. But we wait to see. That's the next step, I suppose, in our journey, isn't it, really?
It is, and perhaps we should hold each of us accountable to that as well, because I've been on a commissioning side and a provider side, and you get that competition that comes into it. Whereas if you look at the key principles behind the ICS and the ways of working, it is a collaborative approach, and therefore if co-commissioning is there, then that's where we all need to be accountable and responsible to make sure that we do have that co-commissioning approach, so that ultimately we are able to ensure that our local communities have that opportunity to be active fundamentally.
Yeah. It's some of the granular detail included in it, but in terms of focusing in on supporting people to live longer, better, there's those elements of collaboration at co-commissioning stage, co-funding stage, obviously programme delivery, and then as a practice piece as well. And we mentioned it right at the start in terms of the social opportunity around ageing and physical activity, and that not to be researchy about it, but certainly the perceived correlation between the two. I'm sure there'll be a research paper that says definitely that there is an absolute correlation at some point. But the point I'm getting to is you've also got a lot of resource out there. So as you termed Live Longer Better as a movement, it's a community of practice and learning. So here's a resource that we've all got access to. Let's all go away and use it and see what we learn from the application of that. And there's some brilliant work being done by the likes of Centre for Ageing Better with their image library about changing the way that it's seen to be active in older age. And it's not a case of it's the middle class white male with grey silver hair that looks great whilst he's out exercising. There's a different version of a person that looks like that could be different ethnicities or sizes or shapes and things. So there's that part to it as well that really, really helps. What is available? What, in terms of resource or places to go, would you say, Annie? Let's give two examples to give you a bit of a challenge. We've got somebody that's listening into our conversation who's maybe designing or delivering a programme that would like to engage older people, or perhaps that person delivering within a programme? Is there anywhere you would point them as a next step beyond this conversation?
I suppose there's various responses to that, and do tell me if I'm not responding directly. And the reason I'm saying that is just from a community practice and learning perspective, we've had this internal challenge of where do you hold all of these resources, and talk, what repository do you have? And one of the things that has obviously come out of the community practice and learning for Live Longer Better is the ability to share the learning and the resources. And Westport, as one example, our colleague within the community practice and learning, she was able to tap into, have access, and ultimately be awarded funding through their local Ageing Well fund, which then used the Live Longer Better principles. And she, to develop her application, we were sharing and supporting her with key elements of it, which enabled her to be successful, not just that singularly, but enabled her to be successful to then put out this active ageing programme as part of the Ageing Well Fund. And she drew on the resources that we had, but it's a great example now because she's now got the Live Longer Better principles active ageing within their area at all across different settings. So in a hospital discharge element, in a care home element, in a residential care home element, as well as then living it independently. So that's some great examples. But what we do at the moment is that we hold that internally, but we recognise that it's not working great either for all of us, but we now need that public facing opportunity. So we are looking into now to develop a shop window, that public facing opportunity from Live Longer Better perspective, which hosts these resources now, and then we can provide those links to, as you quite rightly say, Centre for Ageing Better. But in terms of the immediate, we've got our own website. There is a Live Longer Better website, which is what we want to develop, but there is the Active Partnership National website, of which on that there are the elements of Live Longer Better. Certainly if individuals want to drill down to find out what's happening in their area, go on to the Active Partnership website, drill in there, put in your locality, and it tells you which of your active partnerships is in your area. I'm certainly accessible in terms of helping any other inquiries around what's going on in my area, how can we bring people together. And as I said earlier, a simple piece of mapping that we're doing at the moment with Age UK nationally is to provide those kind of immediate access and direction for people who want to know where to go next. So I think it's fair to say, as you can hear from my lengthy response, that it's in development, Craig.
Yeah. But the fruition of the thing, whether it be a website or a portal or whatever, that comes often long after the thought to try and get there has come there. So I guess the overarching point here is in your local area, there are 43 regionally based active partnerships. Make that reach and say hello, whether you are that individual or organisation wanting to connect. And the big point here in relation to, if we were to try and have a silver bullet answer, how to support people to live longer better, the point here that we're raising is working collaboratively, because it is a very complex and challenging issue, if we can call it that, as a singular entity. So collaboration is key, and we can help whomever it is watching and listening into our conversation by getting involved in that conversation in some way.
Yeah, I mean, one direct way of getting involved in that conversation is to join our national events, which hopefully they're promoted widely, and we can certainly promote further through this opportunity and via the website and other. But that's not, you don't have, anybody can sign up to that, and as part of that, then you could then be connected with some of your local partners as well. So that's great, and that works really well. And then, yes, just getting in contact and coming via the Active Partnership National website as well. And then we will get more of this connection and communication out to make sure that we truly are collaboratively working together and enable then ultimately the individual within our communities to be active.
Yeah, that sounds great.
Mm-hmm.
Curiosity here, you mentioned that in the example that Westport, the Active Partnership, have used to access that funding, that they've applied the Live Longer Better principles. What are they? Is there a place where we can go to find out what they are? Tell me more about that if it comes to mind immediately. I know might be written on a piece of paper somewhere and you can't say it verbatim, but just make me curious.
This is part of the challenge of making sure we now need that external public facing window. We have a Live Longer Better website, but it's very static. And then we're reliant upon active partnerships. So there isn't anything public facing that we have, but we do share these principles between us, as you've just said, as our colleague did in Westport Active Partnership. And fundamentally, that application as an example then was focusing on raising awareness and education amongst all people involved in the system, be that the citizens themselves, the individuals themselves, as well as then the workforce that they're engaging with, that this is around embedding activities for that enablement to shift the curve from caring to enablement. And that's where the different sector partners saw that they had a really good opportunity to be involved in at that hospital discharge phase, rather than just sending someone off home and then the deconditioning. They need that rehabilitation, or they need that ongoing activity to enable them to manage whatever condition it is. The principles of raising awareness within the community as well around what an active lifestyle fundamentally is, and then making those connections locally and increasing opportunities into community activities, and a lot of it through connecting to their Age UK partners, etc., locally, to be aware of. It might be getting together and going for a walk and chatting. As we know, that's just as fundamentally as important as if you're going to go and do a Zumba class, and far more perhaps appropriate for many individuals. And from a systems perspective, that approach is then enabling that systems, embedding it within those systems, because there's this collaborative partnership approach. This isn't just one organisation saying, if you give me X amount of funding, I can put this intervention on and hopefully improve individuals' specific physiological outcome measure, whatever that is. This is more around, if we work collaboratively together, we can have a much better impact across the local community, across the systems, and in this case to enable older people to live more independently and empower them to do so through an active lifestyle.
That's brilliant. That and in that answer is, to a degree, a summary of what we've debated here and some key things to take away. So thank you so much, Annie, for being so generous with your insights and sharing what you have. So in relation to the series, as mentioned, if you are new to the series, we are on episode 13, lucky number 13, we hope, with our conversation with Annie. If you would like to find more episodes as part of the Network Insights series, visit the Move Consulting website, moveconsulting.co.uk/network-insights. And apart from that, we will say our goodbyes. Thank you again, Annie, for your time.
Thank you.
Thank you.